Okay, this video is called Internist Conversation. It's from a conversation I had not that long ago with an internal medicine doctor. And this guy is an excellent doctor. He's known as being one of the smartest, nicest, most conscientious doctors. Very well liked by his patients and by his colleagues and stuff. And so I just want you to see, when a doctor sees a patient, they want to appear confident because it actually produces a more therapeutic relationship. If the patient has confidence in their doctor, they're more likely to get a benefit from the medication and believe in the treatment. And some of that might be a placebo effect, but what does it matter? If it helps to get a better result, there can be a benefit to that. So I mention that because I think a patient will see their doctor looking so confident, but I just wanted to share with you a conversation with one of these, top-notch internal medicine doctors, okay, from one of the universities around where I live. So anyways, he said to me, Pete, I think you're right about all this diet and lifestyle stuff. And I said, well, thank you. Nice of you to say that. What leads you to say that? And he said, I've seen how that low-fat vegan diet can cure a lot of patients. And he said, the stuff we do with internal medicine, all the pills, he said, none of it really makes a significant difference for any of these chronic diseases. And I said, like diabetes, hypertension, coronary artery disease. He said, yeah. So that's the point I'm trying to make to you. The really good doctors, it takes a doctor a long time to figure out what's going on. In med school and residency, you're just trained, match the ill to the pill and send a bill, okay? You don't really have perspective. You don't have long-term follow-up experience. But I think doctors start getting better. If they're conscientious and continuing to study and read as they go along, they really start to improve when they reach about 50 years of age. Because by then, they've seen a lot of people. They know what happens. They've got, a controlled cohort study in their mind from all the thousands of patients they've seen. They know what works and they know what's BS. And so I'm just telling you, this is a top-notch internal medicine doctor. Anybody would want this doctor to be their internal medicine doctor. And here he is telling me the truth. They really don't make much of a difference in the treatment of the chronic diseases. The reason all these diseases are called chronic is because they cannot be cured with a pill. And the reason they cannot be cured with a pill is because they're all due to diet and toxins. And the only way you can cure the disease is if you fix the diet and you avoid the toxins. And exercise helps too, get your sleep helps, sure. But the basic problem is the diet and the toxins. When I say toxins, I mean things like estrogen in the water, estrogen in the food, and, stuff in herbicides in processed food. So anyways, there it is. Top of the line internal medicine doctor saying for chronic diseases, all their pills make essentially no significant difference. Meaning that you might get a little bit benefit from the pill in one way, but it's probably causing a side effect in the other way. So in the end, it's really not making much of a difference.